Hi everyone, it's Dr. Tom Burge again from Enjoy Life Chiropractic and Laser Care in beautiful South Surrey, British Columbia. As a neurologically based postural clinic, it's not uncommon for parents to come up to me and ask, how can I improve my child's posture? They're spending too much time at technology and they're getting to a flex posture that really seems to be affecting their health. Well, stay tuned and I'll go through some of my best recommendations on what you can do to improve your child's posture. So the number one piece of advice that I give to my patients is limit the amount of time your children are on the technology. The Kaiser Foundation, in a study they did in 2010, found that elementary age school children spend 7.5 hours per day on technology. And technology is just conducive to producing poor posture. You probably witness it every day. You'll see children on their phones or iPads and they're slouched in a position like this, producing a forward head carriage, the rounded back, and sort of a pot belly kind of appearance. So we just know that this long-term posture component is just not conducive to health. And so therefore, it's important that you try and limit the amount of time your children are on technology and substitute with something like exercise. Exercise is a fantastic way to not only improve someone's posture, stimulate balance, stimulate proprioception, vestibular or balance components, but also it's fantastic for making the brain more conductive. In other words, you'll learn better when you exercise. So let's try and limit the amount of time your children are using the technology, maybe use it as a reward system, and let's get them outside, playing and exercising. So that's tip number one. Okay, so let's move along to tip number two. Tip number two, I suggest to parents to consider using things like a stability, or sometimes called a wobble cushion. And for our teens, possibly also consider using something like the Posture Medic. We'll talk about that in just a minute. The American Journal of Orthopedic Therapy and also the Mayo Clinic did studies looking at stability balls, and they found that it improved not only classroom behavior, but also productivity. So when you sit on one of these things, it's not supposed to be easy. It's supposed to keep you wobbling around and moving around if you use it effectively. And the idea is not only to work the core muscles, which will help with posture, but there's sensory information that's sent up the spinal cord to different areas of the brain that keep it more alert and more awake for you to be more conducive for the learning experience. So this is a fabulous little device to be able to use in the classroom setting, and quite frankly, I'm not too sure why there isn't more schools that actually have these in their classrooms. The other device I have here is something called a Posture Medic. Now I like this device because what it does two things. Kinesthetically, it allows the shoulders to be pulled back. So you can wear this for a period of time, and it's all outlined in a program included in the purchase of it. But it also is a stretching and a strengthening kind of device. So you can work on the back musculatures that maybe are weak and stretch out the musculatures that are too tight that produce an abnormal rounding shoulder appearance or a slouch posture. So again, tip number two would be consider outside tools like a stability cushion or a Posture Medic to help improve your child's posture. So let's move on to tip number three. And tip number three is exercise. We want to get our children out there working gross range of motion, motor function. We want to be working on their balance, their proprioceptive, and make sure that they build appropriate muscle tone for their body so they can improve upon their posture. You know, for younger children, we can go out in your backyard or take them over to a playground and make a makeshift kind of obstacle course for them where they're walking on beams and swinging from things. All these things improve upon their motor function, their vestibular function, what keeps their eyes in a horizontal plane, therefore keeping their body more in an upright and linear fashion. So working on kind of those motor skills at a very young age is really important for posture. Now as a child gets older, you can move on to things like a 4-point stance where you're doing like an opposite arm, opposite leg kind of exercise to work on their core muscle. Maybe move them on to a planking kind of component or an elbow plank, moving into a full arm plank. And lastly, if you want to work on balance, you can pull out the wobble cushion again, or the stability cushion, and have them stand on that on one leg and see how long they can balance for. You just have to get creative. And exercise is super important for not only making the body more upright and posturally related, but it's going to make it healthier in so many different ways. So let's get the kids exercising, okay? That's tip number 3. All right, and the last and the fourth tip and advice I give my patients is have your children adjusted. The adjustment is one of the most powerful and potent sensory stimulus to the brain in the regions that support your posture. Dr. Heidi Haddock, who's a chiropractic scientist, a neurophysiologist, and the director of research at the New Zealand Chiropractic College, has spent years studying the effects of the chiropractic adjustment on the brain. And her scientific studies have shown that chiropractic, the adjustment itself, can change the way the brain's cortex processes proprioceptive, in other words, sensory information from your limbs, and how it deals with that proprioceptive information. So being adjusted is just conducive to not only the well-being of your child, but also important for the brain being aware of where the body is in its relationship to the environment. So I think having a child, at least minimally having a posture check once a year, is extremely important, and then attend to those areas that need to be adjusted. All right, parents out there, that's the advice I pass on to my patients for helping to improve their child's posture. Make sure you limit the technology. Try to use possibly devices like a wobble cushion or try a posture medic. Exercise and get adjusted. If you need help with your child's posture, please don't hesitate to call us or visit our webpage at enjoylife.ca. Hey, and don't forget, make posture a priority and not a liability. Bye for now.